In the name of Allah, the gracious, the merciful. Assalamu alaikum. My name is Fatma Munir. I'm from BS Biotechnology, and this is second part of my presentation. And the topic of my presentation is hydromorphone and oxymorphone. Now, extending forward, first of all, I discuss effects of hydromorphone. Basically, hydromorphone is a powerful opioid pain medication used to relieve moderate to severe pain. It affects the central nervous system and can cause side effects such as nausea, dizziness, drowsiness, confusion. It can also lead to respiratory depression, a potentially life-threatening condition. Effects in liver. Hydromorphone is strong pain reliever that is primarily metabolized in the liver. It is broken down into inactive metabolites that are then eliminated from the body through the kidney. In individuals with liver diseases, hydromorphone may be metabolized more slowly than in individuals without liver diseases, which could result in higher drug levels in the body and greater risk of side effects. Effects on kidney. Hydromorphone is a pain medication that is primarily metabolized in the liver and excreted through the kidneys. In patients with compromised kidney function, the elimination of hydromorphone may be slower, leading to an increased risk of adverse effects. Therefore, it is important to monitor kidney functions in patients taking hydromorphone, especially those with pre-existing kidney diseases. Effects on brain. Hydromorphone is an opioid pain medication that works by binding to specific receptors in the brain and spinal cord. Known as opioid receptor, this is binding can produce a number of effects on the brain, including pain relief, feeling of pleasure or euphoria, drowsiness, and slowed breathing. However, hydromorphone can also cause some negative side effects such as confusion, dizziness, nausea, and constipation. Effects on central nervous system. Hydromorphone is a potent opioid pain medication that acts on the central nervous system by binding to specific receptor in the brain and spinal cord. When hydromorphone bind to these receptors, it decreases the perception of pain and produces a sense of euphoria and relaxation. However, hydromorphone can also cause negative effects on the central nervous system in high doses or when misused. Some of these effects include slowed breathing, dizziness, confusion, drowsiness, and even coma or death in severe cases. Effects on cardiovascular. Basically, hydromorphone is powerful opioid analgesics that can have an effects on the cardiovascular system. When administered, it can cause a decrease in the blood pressure and heart rate. This is due to the fact that hydromorphone acts as a vasodilator, which means that it widens blood vessels and allow blood to flow more easily. Effects of oxymorphone. Oxymorphone is a powerful and narcotic pain medication that it is used to manage moderate to severe pain. It works by blocking the pain signals from reaching the brain, basically providing pain relief to the patient. However, like all opioids, oxymorphone can cause severe side effects. Several side effects, including drowsiness, nausea, constipation, dizziness, and respiratory depression. In rare cases, it can also cause serious side effects such as allergic reaction, seizures, or serotonin syndrome. Effects in liver. Oxymorphone is a potent opioid analgesic that is primarily used for the management of moderate to severe pain. Like other opioid, oxymorphone can have certain effect on the liver. Here are some considerations regarding oxymorphone and its impact on the liver. Hepatotoxicity. Oxymorphone itself is not considered highly hepatotoxic, meaning it does not typically cause direct liver damage. However, in rare cases, it may contribute to liver injury, particularly when used in high doses or in individuals with pre-existing liver conditions. Metabolism. Oxymorphone is extensively metabolized in the liver. The liver enzyme responsible for metabolizing oxymorphone include cytochrome, and in individual with liver impairment or reduced liver function, the metabolism of oxymorphone may be affected, leading to altered drug clearance and potentially higher levels of the drugs in the body. Drug interaction: oxymorphone can interact with other medications that are metabolized by the liver, in particular drugs that inhibit enzymes such as certain antidepressants, antifungals, or HIV protease inhibitors can increase oxymorphone levels and potentially lead to increased opioid effects or side effects. Monitoring: patient taking oxymorphone may undergo periodic liver function tests to assess liver health. Measure level of certain enzymes such as alanine aminotransferase and aspartate aminotransferase, which can indicate liver damage or dysfunctions. Regular monitoring help identify any potential liver related issues early on. Effects on brain: oxymorphone as an opioid analgesic primarily acts on the central nervous system, including the brain. Here are some effects of oxymorphone on the brain: pain relief, euphoria and sedation, respiratory depression. One of the significant effects of opioids on the brain is a suppression of the respiratory center. Oxymorphone can depress the activity of the brainstem, leading to decreased respiratory rate at depth. These effects can be potentially dangerous and even life-threatening if excessive doses are taken. Cognitive and psychomotor effects: opioid like oxymorphone can cause cognitive impairment, including slowed thinking, difficulty concentrating, and impaired judgment. They can also affect psychomotor skills, coordination, and reaction time, which can have implication for tasks requiring a mental